Thank you, Mr Speaker. My question's to the Minister for Disability Services. Minister, as at today, we have a total of 1,825 reported COVID cases in the wider Tasmanian community. Over the past fortnight since mask protections were removed, an increasing number of Tasmanians with disability have been infected with COVID. Do you agree, because many people with disability are reliant on in-home supports, they are particularly vulnerable? They can choose to stay at home to protect themselves while community transmission is rampant and masks are removed, but they can't protect themselves in their homes. What steps are you, as Minister, taking to make sure people with disability are not placed at higher risk of infection? Have you, for example, ensured they're receiving high-quality advice on how to prevent infection from a virus that, on the evidence, has the potential to take their lives or disable them further as a result of long COVID?
Honourable Minister for Disability Services.
I thank the member for the very important question, and it is a very important question. These are unprecedented times, Mr Speaker, and I thank everybody for doing their bit to keep us safe. And I also understand, of course, that this time may be causing quite a bit of anxiety in our community, particularly for the disability sector.
You're disabled?
No,
Terror,
it's an important
not just
question.
anxiety.
I agree with you. It's a very important question. I want to thank all Tasmanians with disability, carers and service providers for their assistance and understanding as we work together to ensure that we all stay safe. The Tasmanian Government is committed, and I am committed to supporting people with disability, their families, carers and support workers through the pandemic. I care deeply about this matter. And we are continuing to work with the Australian Government, the National Disability Insurance Agency, the NDIS Quality and Safeguards Commission, that's important, the disability sector itself and advocates to ensure people with disability and their families continue to receive the information and support they need through the COVID-19 pandemic.
Point of order,
Mr Speaker.
Mr Speaker, Standing Order 45 relevance. For people with disability, could the Minister explain what information is being provided to them to help them keep safe? Yes, it is.
Again, thank you for the point of order. As you know, I can't tell the Minister how to answer a question. It appears to me as if she's answering along the lines of the question that you put, but no, I can't put words into the Minister's mouth.
Thank you. I do have some more, which I think will help answer the question. Of course, we're committed to ensuring people with disability, particularly children, at this stage of the rollout, their carers and support workers are prioritised to receive the COVID-19 vaccine, which is our best protection against COVID-19, Mr Speaker. And it is still required for people in Tasmania who are employed or engaged to provide high-intensity supports for NDIS participants to be fully vaccinated. So I think
that's
that goes
not the only protection.
Order. Leader of the Greens, order.
The National Disability Insurance Agency has put in place a suite of measures to help participants who may have been impacted by COVID-19 to ensure they continue to receive the essential disability supports they need, Mr Speaker. And of course, participants can contact the NDIA directly. But I would also say that the health and safety and wellbeing of Tasmanians is our number one priority, Mr Speaker. And some
order.
It's an important topic. Some people are clearly more vulnerable to serious impacts from COVID-19, and we have prioritised those groups for vaccination, and this includes those with disability. Our Tasmanian vaccination team has been working with disability peak bodies, offering tailored information sessions to people with a disability, their families and carers. Additional support and quiet day clinics have been offered, and additional support is available at clinics if needed. Our Disability Emergency Operations Centre, which is fantastic, continues to support providers and people living with disability to respond to COVID-19 outbreaks. I do thank the member for the question. Our disability sector is...
Point of order, Mr Speaker. We cannot let the Minister sit down. 45 relevance. People with disability want to know, where's the information on preventing infection?
Right. Before you start there, Minister, It is of course, Standing Order 45 is raised in this chamber a number of times, and allowing considerable latitude in the content of the question has become an acceptable practice of the House, and it therefore informs the practice of the House in relation to Standing Order 45, where the quid pro quo is proportionate when proportionate latitude is also given to the answer. I also note the practice of the House of Representatives where provided a minister addressing the policy topic, which is the subject of the question, the answer is deemed relevant. So I ask again the minister to stay relevant and, of course, continue or conclude your answer, please.
Thank you very much, Mr Speaker. I will wrap it up because I have taken some time to answer in detail. A public health direction was signed on the 11th of March requiring that a person employed or engaged in providing high-intensity support to an NDIS participant must have received a booster dose of the COVID-19 vaccine by 1 April, and if not yet eligible, have received the booster within 4 weeks of becoming eligible. Mr Speaker, the disability sector is very close to my heart. I care deeply about the people who participate in it, people living with disability, their carers, and particularly families. The supports are there, they are in place, there is information that they can seek, and I hope that that is a robust answer. But if there are individuals who are concerned or who want more, my door is open and I'm always happy to respond.